Hello, beautiful people. My name is Dr. Leah Hollon. I am here today because I want to share something really cool with you guys. But in the meantime, before we get there, I wanted to share this with you. Genius at work, right? Isn't that what you are? Isn't that what we are, right? Genes, genius, play on words. Isn't that so fun? Well, as you know, it's not just about genes and it's not just about the environment, right? Together, it's the epigenetics. So I want to talk about something related to our epigenetics and how we express things and also how we can actually break down things in our environment. So stay tuned to the end. I'm going to give you 3 specific things that may help you if you have had a negative drug reaction before or someone that you love or care about. So each of us is unique, right? And the reason that this is so important to talk about when we talk about trauma or even lineage imprints is a lot of times when I sit down with a patient, I go very thoroughly through their family history, and they might say, oh, my mom has horrible allergies. My dad has had heart disease. Or I don't know my family history and I have a lot of allergies, or I've had a lot of issues with drug therapy. So a lot of folks that come to see me, they have failed second, third, fourth line therapies. And I'm like their 15th or 17th doctor that they're coming to. And so they have failed all of those drugs and they were hoping that it would help them. And so, going back to a few things, we have been told oftentimes like, oh, many doctors like, I don't understand what's happening, right? Like they're following the algorithm, but algorithms are not very person specific, unfortunately. And just because you might have a certain condition or disease, doesn't mean that that's a perfect fit for you for that drug. And I'm not telling you not to take a drug. I just want to be really clear. This is more about folks that do not tolerate drugs very well and they don't understand why. Well, this can be related to lineage imprints because we inherit the actual what we would say receptors or enzymes that actually can help us break down some of these drugs. So for example, if someone's parent cannot break down a certain drug, there are certain what we would call enzymes that break that down. Well, that can be imprinted onto their children and grandchildren, and then they also have some of those issues. So a lot of times I'll have people come to me and they're like, oh my gosh, my mom's can't do all these drugs, or my dad can't do all these drugs, or I don't know my history, but I'm having lots of reactions. And I can usually, if they tell me a little bit about their history, I can usually determine, just because of the work that I do and teaching in pharmacy, I can usually tell what SNPs, or I would say mutations, are possibly expressing. So this is so important again, because what we realize is when people have trauma or PTSD, or even a lineage imprint, it imprints, right? And then it's actually carrying through. So some people may say, oh, well, I inherited that, but not until I had that really bad accident or there was that natural disaster did I start having these allergy symptoms, or that I started having panic attacks, or that I was having a lot of body pain. So again, you may have been given, we've talked about this, you may have been given the code, but it didn't express until that big thing happened, like a trauma. So let's go into this a little bit. So let's talk about a concept called pharmacogenomics. And pharmacogenomics is a long word, but if you kind of break it down, it tells you exactly what it is. So pharmaco, right? So that's drugs with your genes. So pharmacogenomics, so genes in your drugs. And again, not everyone processes drugs the same way. So let me explain. We could take 10 people and we give them the same drug. And let's even say they're the same age, or relatively, they're the same weight, the same biological gender, but not all of them are going to break down the drug the same way. And unfortunately, this is the way that medicine has been carved out for too long, to be honest with you. And unfortunately, when this happens, people can have severe side effects. And in fact, their drug is not working as well as it should because they can't metabolize it appropriately. So for example, there are certain drugs out there, especially in the cardiovascular drugs, that we think about even around things that are like anticoagulants, which basically helps us to not have a stroke or those kinds of things. And not everyone can break them down the same way. So somebody might bruise more often, or they may not be able, or they may even still have heart arrhythmias and they're throwing clots. And so we have to be very specific for people. So again, it goes back to, in many cases, our lineage of how we're breaking down these drugs. And so there's this new science, again, pharmacogenomics, where we can actually be more person specific. So when a person comes into me and they're like, I don't do well with this drug, and they have a laundry list of drugs that they've had negative adverse reactions to, I need to send them to get more help. And so a lot of times the doctors, they feel like their hands are tied because they have an algorithm and they have to go along with exactly what it's saying, and they don't want to go outside the box because that puts them at a higher risk for being sued. And then the insurance companies, I mean, it's just heartbreaking in many cases because so many doctors realize it's not working, but they feel like their hands are tied. But the good news is that we can actually do testing. And we can actually test some of the top 200, 100 drugs that are out there. And then for some people, like if they happen to be having adverse reactions to something like, let's say they've had breast cancer in the past and they've had a negative reaction to a SERM, which would be like something called tamoxifen, or if they've had an adverse reaction to aromatase inhibitors, like aromacin, those kinds of things, Arimidex, if they have any issues with that, we could look at it a little bit more closely. So for example, there are standards in pharmacogenomics that all of these researchers throughout the entire world have pulled this research together and have come up with new standards, including a drug like tamoxifen, of like if someone can't break it down, then they need to change that actual either drug, or they need to actually change the dosing. Unfortunately, a lot of these drugs are only one form of dosing. So we could take those 10 people and 3 people may metabolize it just fine, and that's called like a normal metabolizer. And then there's something called an ultra rapid metabolizer, and basically they're like Cookie Monster, and they're like trying to break it down so fast, and actually it's causing more harm in the body and more oxidation, more damage in the body. And so oftentimes they might actually need a little bit more of a dosage to actually be therapeutic. And then other people, they can't break it down very well at all, and they need to have a dosage reduction of 30 to 50%, and they're actually called a slow metabolizer. And then there's some people that it completely stops working at all, and they can't break the drug down. And so in some cases, what I see for people is that they can barely get out of their chair, they are having bone pain, they can't sleep, even their osteoporosis gets worse. So, again, it's not about saying that we shouldn't be doing drugs, but I think what we really need, if the drug is needed, we need to be more person specific so it's therapeutic, right? I mean, we all want the same thing. If somebody needs to be on a drug, we need it to be more therapeutic. So here are the 3 things that if you think that you're having issues related to lineage trauma and you've inherited that, related to breaking down your drugs. Maybe your pain isn't well controlled. Maybe you're having issues with sleep. Maybe you're having panic attacks. Maybe you've been on all kinds of different meds and they've run like something called like GeneSight and trying to figure out what drug would be best for you. That what I recommend, here are the things that I recommend is, one, that they talk to their doctor. And it could be their primary care doctor, or it could be their specialist, to ask for pharmacogenomic testing. Unfortunately, a lot of doctors don't know this. Again, they think their hands are tied, but actually there's a lot of freedom. And also there's, again, standard of care. They have updated this related to pharmacogenomics. So we have it out there. There are clinical guidelines for this to help our doctors do a better job related to dosing for people. The second thing that I recommend is if for some reason that they cannot get in touch with a doctor, whether it's a primary care or a specialist that would be open to running it, they can actually get with pharmacists oftentimes who will collaborate with other types of specialists to help them get the testing. Like a lot of mom and pop places will do it. And what I mean by that is mom and pop, like community pharmacists. That can be really helpful. You can ask to speak with the pharmacist in charge. And then sometimes within hospital settings, especially if it's like a level 1 trauma center or a teaching hospital, they usually will have pharmacogenomic testing within each of those hospitals. And the reason that this is so important is that so many people end up in the ER having severe adverse reactions to normal typical drugs. And so they're the ones that are trying to figure this out without hurting people, right? And in some cases, we've had patients who have, it's been so severe that it's been life-threatening, and no one wants that either. So I think it's going to really free things up for people. And again, for some, for some people who've had trauma, it's very scary if you're trying drugs and you don't feel confident in how you're going to respond. And so then the third thing is that these doctors is that they will then look at the clinical guidelines. And so there's something called PharmGKB and PGX, and basically they can go to those sites, and it's actually, those are free access, and they can plug in the drug, and it gives the recommendations if there happens to be mutations. And what's beautiful about this is that a lot of those pharmacists, because the doctors aren't aware, the pharmacist can actually help with this and give them a little bit more insight into how they could be still therapeutic. So I know I hit you with a lot of information today, but the reason I'm sharing this with you is that for a lot of my folks who have had trauma, PTSD, and also have had lineage trauma, they're on a lot of drugs and they're failing the drugs. And again, we can't just think about only drug therapy. We have to go to the root cause, which again, it's not just on the chemical level, right? We know that it is, but to some extent, it's also on the emotional and spiritual level. And so we're going to have to do some more work on that. So stay tuned. In the future, if you have any questions, please let me know. You can put it down in the comments, and great being with you. Take good care.